Welcome to this edition of Pulse on Health. I'm your host, Mark LeMay. It's another month, and as we're about to make our way into 2022, we're still talking about coronavirus. There's the ever-present Delta variant still running rampant throughout the world, and now there's the Omicron variant, which has yet to make its mark. Joining me on this edition of Pulse on Health, Dr. Nick Weida, Medical Director of the Haverhill Street Clinic at GLFHC. Welcome to the program, Doc.
Hi, Mark. Thanks for having me here today. Appreciate it.
I want to lead off with a clarifying question. The increase in virus numbers we're seeing in the US is a result of the Delta variant, correct?
Yeah, that's correct. The current variant that's most prevalent kind of amongst the COVID PCRs that are being analyzed is the Delta variant. So basically, the way that we figure out whether we have Alpha variant or Beta variant or Delta or now Omicron is that when if a person ends up with a positive COVID PCR, the CDC takes a certain number of those samples and runs sequencing on it to figure out what exactly is the variant that exists. So in this case, over 99% of the sequenced variants currently are Delta variant across the US right now. Now that could change, currently, there's projections that Omicron could significantly overtake Delta over the next couple of weeks or months. It's tough to know for sure, but currently this is a Delta surge in the U.S. right now.
I'm going to have you put your magical 8-ball hat on for a minute and ask, why is there such an increase?
Yeah, I mean, that's a great question. I can tell you that we have had a hard time since the beginning of this of appropriately projecting when we're going to have a surge, how long the surge is going to last, how many people are going to be involved in the surge. It's really been somewhat humbling in terms of trying to project this virus. We can make our best guesses. In terms of, we often say that winter months are worse for viruses, for respiratory viruses, because people are clustered in homes. And you're doing less outdoor activities. There's more holiday parties and such. So often the flu, for example, really is most pronounced during winter months. And that was last year, about this time, we had a major surge in Massachusetts of COVID. And so that kind of followed the projection. However, last year in February, we had a huge drop off in cases, which didn't really make much sense because we were kind of expecting that we were in the heart of the winter months. It didn't, you would expect that we would continue to have a continued surge. So that's why I'm saying we can say that winter months generally bring about higher transmission of respiratory virus. Across the Northeast, we're seeing a really big surge right now, which would fit with that. But that's not always the case. And then the second thing is that the emergence of the Delta variant. That kind of, very much mimics where we've seen the surge kind of across the South. And now here, as a new variant that is more contagious, becomes more prevalent, that can lead to a surge as well.
So correct me if I'm wrong, but the numbers that you guys see in the medical field aren't reflective of the current situation. It's basically 3 or 4 weeks old. Am I understanding that right?
I mean, we have pretty good data in terms of like the actual prevalence and how many COVID cases we have. Our data is pretty accurate and pretty recent. We're collecting data from last week for Massachusetts, for example, and that tells us where we're at on a week-to-week basis. And so when we're seeing a significant increase in the number of people who are testing positive, that's really reflecting pretty real-time data, maybe 3, 4, 5 days old, but certainly not a month old. And so I would say that as of right now, Massachusetts is kind of back in what we call the red category, green, orange, red. We're kind of in that top level of transmission and risk compared to where we've been at for the last kind of 10 months.
Can researchers and doctors tell how effective the vaccine is and or the boosters against Delta and Omicron?
Yeah, so there's been a lot of research looking at this, first with Delta and then now with Omicron. With Delta, we know that based off of some of the initial studies that come out, both that have been published by Pfizer, by some of the drug makers, and then also some various countries that have been doing surveillance, that the Pfizer, Moderna, and J&J vaccine are all less effective at combating Delta than they were against Alpha, Beta, some of the earlier variants. That being said, they're still very effective. So whereas the vaccine was something like greater than 90% effective in preventing infection with Alpha and Beta, it's probably, closer to 70% with Delta, but it's still over 90% effective in preventing hospitalization when it's been administered within the last 6 months. Now, the next 6 months, again, we're talking about Delta, is key because they started to notice that there was some waning immunity after 6 months, which is why that booster has been recommended, particularly in the setting of having Delta and now Omicron, is because there's a feeling that our immunity wanes over time. And because the vaccines are so remarkably safe, the benefits of increased immunity and revaccinating or a booster outweigh any risks that could exist.
And again, getting the vaccine and or the boosters doesn't prevent someone from getting coronavirus, correct? It lessens the effect of it?
I mean, both, again, against the initial variants, Alpha, Beta, some of the other early variants of COVID, the Pfizer and Moderna vaccine were 95% effective in preventing infection. That's preventing any infection. Against Delta, probably less so, and probably closer to 70%. So still pretty effective in preventing infection, 70% effective in preventing infection. But less effective than against the earlier variants. In addition, people who do get the infection, which we would call kind of a breakthrough infection that you would get even though you've been vaccinated, they likely have much shorter durations of being sick. They're much less sick, and they shed the virus, infect others at a far less rate than those who have not been vaccinated.
What's the difference between Delta and Omicron?
Yeah. So, talking about what the exact difference is. So the difference is that different variants have different mutations. So a virus, as it replicates, it makes mistakes. And some of those mistakes don't end out so well. So the virus dies. Other mistakes are kind of what we call gain of function or improvement mistakes that actually end up in citing an advantage for the virus. And so that one gets preserved and then continues to replicate and outcompete the other variants that might be, for example, in somebody's body. And then that becomes the dominant one. And that same situation kind of plays out in society as well. You have a variant that has more mutations that's more effective at affecting others than the old variant. And so it becomes the most prevalent variant out there. So we think that based off of how quickly Omicron, we know that Omicron has a bunch of mutations on its spike protein, which is the protein that kind of impacts infection. And we know that it has quickly become the most prevalent form of coronavirus in South Africa, so quickly that it would suggest that it far outcompetes Delta, which was the previously most infectious, most rapid spreading variant prior to this. So that's kind of the extent to what we know. We don't know whether it's more severe. There's some evidence that maybe it's a little bit less severe than Delta, but it's really too early to tell. I mean, we've only known about this variant for a couple of weeks now. So it's remarkable that we know as much as we do now, actually. But we're going to know a lot more over the next couple of weeks as we start to look at vaccine effectiveness and how sick people are getting, and as we kind of start to collate some of this data.
How many variants can a virus have? Is it endless?
Yes, essentially, yes. A variant. So a variance is just basically a different form of the virus. So anytime you have a mutation, that's a variant. But variants of concern or variants of significance are what we're kind of more so looking at. So Alpha, Beta, Delta, Omicron, they were all variants of concern or significant variants that imparted a difference in the way that the virus behaved compared to the other variants. So we talk about Delta so much because Delta behaves differently than the previous variants did. And so it's it's remarkable in that sense. And that's why Omicron's come up, because it behaves differently than Delta. So we need to kind of further characterize. It's still the same virus, but we have to figure out, okay, how different does it act compared to some of these other variants?
Are vaccine makers working on specific boosters for the Omicron mutation? And if so, should people wait to get that booster instead of what's out there now?
Yeah, so that's a great question as well. First of all, people should definitely get the booster when they're due for it. That's unequivocally, the way that you should go to prevent getting an infection at this time. Again, we've only been aware of Omicron for a few weeks, so it's a little bit too early to have conclusive evidence. But Pfizer had recently published some data suggesting that the recent booster dose created immunity to Omicron that was similar to the immunity that was induced against previous variants. So that would suggest that recent boosters do have an impact on decreasing your risk of Omicron. However, there's been some evidence that vaccination that's a little bit older, closer to the 6-month period of time, might only be 30 to 40% effective in preventing infection from Omicron. That's far reduced, obviously, from what I was telling you, 95% against the earlier variants. But at the same time, even that data that suggested that maybe it's only 30 to 40% effective if you've gotten that initial dose but haven't gotten a booster, it still seems to be about 70% effective in preventing hospitalization. So even if you're somebody who hasn't gotten boosted yet, and you were to contract Omicron, it looks like that the initial immunization series will significantly reduce your risk of hospitalization and death. And those are the things that we really care about. Obviously, we care about whether or not you get sick, but if you get sick and it's just a mild cold, that's a totally different thing than if you're in the hospital and if you're spreading the virus to other people who are in the hospital as a result as well. And now I know the second part of your question then was, is there something being developed specifically for Omicron, right?
Mm-hmm.
I'm not aware of any particular vaccine effort that's being made to combat Omicron right now. There has been talk that Pfizer, Moderna, some of the other major drug companies are working on trying to project future variants, as well as kind of variants of concern that exist right now, and reconstitute a vaccine. But anything that would be created is many months away. It certainly hasn't gone, if you think about the extensive FDA approval process that occurred for these initial vaccines, it took many, many months and multiple trials on large size populations before anything was approved. You would need to have something similar to that before you got a new vaccine available.
We're talking with Dr. Nick Weida, Medical Director of the Haverhill Street Clinic at GLFHC. We're going to take a quick time out. When we come back, we're going to continue our conversation about coronavirus right after this. Welcome back to this edition of Pulse on Health. I'm your host, Mark LeMay. Our guest this week, Dr. Nick Weida, Medical Director of the Haverhill Street Clinic at GLFHC. Doc, from what I understand now, it's not just a matter if you get the vaccine, but if you get the booster shots as well.
Yeah, and sorry, I may have kind of already answered this question a little bit, in the sense that we were talking about kind of how effective the initial vaccine series was against Omicron. And and I just kind of reiterate, it seems like, again, this early data on Omicron suggests that maybe this initial 2-dose regimen, when being administered, 6 months ago, might only be 35% effective against Omicron. Again, that's one small study coming out of South Africa that's suggesting that there's significant waning immunity against these new variants. But that a booster produces a much higher antibody level in your own system, and that should confer maybe about a 75% protection against Omicron. So in that sense, yes, a booster is going to substantially reduce your risk of getting Omicron this winter. I think that Omicron is probably going to become the dominant form of this virus over the next couple of months. Even if it doesn't, and Delta continues to be the dominant variant, that booster will again kind of push you up in terms of your reducing your risk of getting infected. Certainly the initial series is most important because it seems to have lasting impact in reducing your risk of hospitalization and death. But getting that booster is probably giving you a really great advantage in terms of reducing your risk of actually getting the virus altogether.
Now, I'm sort of picking apart what you're saying about Delta and Omicron, but you said the next couple of months. Do you foresee us going back into some sort of lockdown setting, some sort of heightened awareness, heightened mask wearing, anything like we've had in the past 2 years?
Yeah, I mean, certainly as much as I am giving you lots of caveats regarding how to predict the way that the virus is going to behave, I have even more caveats when trying to describe how we as a society are going to react to the changes on the ground. I think that, we can talk on one side, okay, what's the science of what's happening? What's exactly going on in terms of the virus and, vaccination and all that type of stuff, public health measures to mitigate. That largely relies on, evaluating where you're at, what your hospital capacity is, whether or not you're kind of overwhelming your ability to take care of patients who get sick, and whether you need to modify behavior in order to kind of substantially reduce the burden on society. And so I don't think we're ever going to go back to where we were, 2 years ago when we entered our initial lockdown. We have substantially more knowledge and understanding of what we're dealing with now, of what measures work and what measures don't work. But I do think that, we could certainly see changes on the ground. I know California just instituted a universal mask mandate again. I wouldn't be surprised if Massachusetts considered something like that again going into the winter months, particularly as we're seeing a recent surge. You could see changes in the way that your doctor's office asks you to kind of come in, whether you're not coming in with other people to your visits, or whether you're not coming in if you have certain symptoms. So we could certainly see changes again in reaction to the data that we're seeing on the ground on a week-to-week basis.
I've asked Dr. Kelly this probably a few times in the past couple of years, but do you see society having to get a booster shot every year against the coronavirus?
Yeah, it's I think too soon to tell, because again, we haven't seen how this initial dose series kind of reacts over time. You know, some people have argued that based off of the data we have so far, maybe we should have considered the Pfizer Moderna vaccine to really be a 3-dose regimen. The first 2 doses that we got initially, and the third dose is really what constitutes your initial kind of dosing of the vaccine. And then we can decide boosters later based off the fact that the antibody presence so significantly increases after that third shot. So it's possible that that third shot is going to confer immunity that lasts for years and is effective against multiple variants that become more dominant. Or it's possible that there'll be more variants that escape from this vaccine and we need to make new vaccines that are more effective against those variants. Or it's possible that immunity continues to wane. So there's just so many variables out there right now. I think it's tough to tell. I think that sometimes people get kind of really perseverate on this too. I've heard people say, well, I don't want to get the vaccine because we're just going to have to do this every year. And I wouldn't really, I wouldn't focus as much on next year, 2 years from now, 3 years from now. What makes sense right now? What makes sense right now is getting that first dose series, getting the booster, and then we'll reevaluate. And if a year from now, we're looking at data that suggests that we need a booster or such, we cross that bridge when we get to it. But I think sometimes we get distracted from what makes the most sense now based on what we have now. And it's pretty obvious and clear what we need to be doing now to reduce transmission and improve our chances.
Now, testing is still taking place, but can the test tell you or the provider what variant of coronavirus a patient has if they come up positive?
Yeah, so if you take the test, me and you individuals, if we go to to the Lawrence testing tent or Methuen or Haverhill or anywhere else, and we get a PCR test that gets sent down to Boston to be analyzed, or to another major laboratory, we will just be told whether we are COVID positive or COVID negative. What happens from behind the scenes is that the CDC takes a certain proportion of those positive results and looks to see what variant exists. And that's how they then say, okay, well, in Massachusetts, it looks like there's 99% prevalence of Delta right now, because they sample a certain number of positives and they send that data back to us. But you'll never get that individual data. Now, that being said, right now in the US, something like 99% of infections are Delta. So if you test positive for COVID, you have Delta most likely right now.
Here's an odd scenario. What if someone gets the flu and coronavirus at the same time?
Yeah, we have luckily not seen a lot of this so far. One of the interesting things about respiratory viruses is that often only one of them, particularly annual respiratory viruses, that normally only one of them is super dominant at the same time. And so what we saw last year was that because of all the prevention measures that we were taking to prevent COVID, masking, being super cautious about when you're sick, staying home, and everything like that, we saw remarkably low flu activity, one of the lowest flu activity years in a long time. Largely because we were trying to prevent COVID transmission, but the flu wasn't quite as effective as transmitting as COVID. And so it really dropped off. Mm-hmm. So I have no idea what that means for this year, that being said, because now with an extra year, people's immunity to flu, which decreases after every year. That's why we need annual flu vaccines. People's immunity to flu may be reduced farther. So there might be more of an opportunity for flu to resurge this year. It's tough to really know. Yes, you can definitely get vaccinated against COVID and the flu shot at the same time. I got my booster and I got my flu shot on the same day. And I would definitely recommend getting both this winter. But it's tough to say what exactly that would look like because, quite frankly, I have not actually seen a case of concurrent flu and coronavirus yet.
And you just answered my next two questions. Yes, you're still encouraging patients get flu vaccines. And yes, you can get your COVID vaccine and your flu shot at the same time.
Yep, that's absolutely correct.
I'm kind of have you put your personal hat on and wear your doctor hat for the next question. Do mandated vaccination rules work?
Yeah, so also a loaded question that a lot of people have been debating.
Absolutely.
And I think there's two, the one question that people are asking is, should there be mandatory vaccine rules? And the second is, do they work if implemented? So I'll tackle the second one first, because that's easier. Okay. In short, mandatory vaccine rules work, particularly when companies implement mandatory vaccination requirements. We have seen that the first major company to do that was a hospital system in Texas, which I think they had something like an 80% vaccination rate pre-mandate, and then they went up to 100% vaccination rate post-mandate, obviously, and had pretty minimal attrition in terms of people who chose to resign or quit as a result of that mandate. And I think we've seen that replicated across multiple businesses that have moved to mandates, is that many people who were initially reluctant actually, kind of like their job and decide to actually get the vaccine once they're kind of pushed in that direction. And so we haven't seen massive resignations, particularly across healthcare institutions, as we've produced those mandates. So that's kind of the first part, is do they work? Yes, they absolutely work in terms of improving vaccination rates within companies. In terms of, should we have them? Well, there's always been a precedent for vaccine mandates in different settings. We've always required kids to get immunized to go to school because we've seen what polio and measles and other kind of really awful viruses have done in the past. And so we have, for a long time, required vaccines in those settings. We've, for a very long time, required vaccines of healthcare workers and other high-risk workers so that we can decrease the risk of transmission of this, potentially deadly diseases to our patients who are coming into our clinics or who are going into other settings where there's higher risk of transmission. So there's certainly a very robust precedent for mandating vaccines. And so I'm totally on board with that. And then there's an additional component, the next step, which is vaccine passports, and this idea of requiring proof of vaccinations so that you can go into restaurants and into other public establishments, concerts and everything like that. And there's not as much of necessarily a precedent for requiring vaccinations for those type of settings. However, they are effective in terms of decreasing risk of transmission. And again, when I think about, what I think as society we want to be able to do, we want to be able to try to get back to some semblance of normal life. We want to start being able to go out to the movies again, go to restaurants again, doing things and feeling safe. And in order to do that, I think there are some common sense, things that we should think about. And, if in, higher risk settings, masks make sense when there's higher prevalence, I think we should go ahead and do that. And when you have a extremely safe vaccine that is also pretty effective at preventing infection, and in particular, very effective in preventing severe infection, I think we absolutely should make that decision if it means that we can get back to being kind of a functioning society. So I know that's a bit of a long-winded answer, but it's a lot to unpack.
And it's not an easy answer. It really isn't. I appreciate you kind of putting yourself out there for it. Real quickly, what's your advice for the holidays, for people getting together with families for Christmas and specifically New Year's? What is your advice at this point?
Yeah, I think, I saw a picture after Thanksgiving of somebody's family gathering in which they had a flower basket in the middle of their table with a bunch of rapid COVID tests. And so everybody was rapid COVID testing themselves when they came into the house for their family Thanksgiving dinner. And I think there's some definite truth to that. I think that, before family gatherings, if you're able to get your hands on rapid testing and you're able to do some rapid testing, which is not as sensitive or specific, so not quite as effective as your PCR testing, but it's probably about 70%. So it's certainly better than just guessing. That's certainly something that you could use, have everybody before a family gathering rapid test. Even better if you're able to get COVID PCR testing before a gathering. I would particularly recommend that if you're going to see kind of vulnerable family members who are immunocompromised or are elderly. Those people are going to be people who are at increased risk from the virus, even if they're vaccinated. And so having everybody tested prior to that gathering is going to reduce your risk of having kind of a major spreading event. And then there's some other things that you can consider doing, particularly kind of in more of the work setting. It's tough to say, don't have dinner with your family or even a little bit of your extended family. And I think you have to kind of be smart about that and mitigate risk, like I said, with, testing. But in settings where you don't have to have an eating gathering, a work outing or something like that, normally you do a work lunch for Christmas. Maybe you just do a gift exchange without eating together. Maybe you do to-go food to have afterwards, and you eat it separately. Considering smaller gatherings where it said you might have done larger gatherings in the past. I think all those kind of small things along the margin can make a difference. And so just kind of really thinking deliberately about the decisions you're making, realizing that everything you do imparts some degree of risk in life, whether it be COVID or not, and trying to balance out those benefits and risks of what you're choosing to do over the holidays.
Dr. Nick Weida, Medical Director of the Haverhill Street Clinic at GLFHC. Thanks for being our guest on this edition of Pulse on Health. Really appreciate it.
Thank you so much for having me.
And just a reminder, you can catch all of our podcasts on our website at glfhc.org. Until next week, have a healthy weekend.